So about our presenter for today is the person of Dr. Olugbenga.
So welcome everybody. So this is to talk about breathing beyond basic, exploring the role, scope, and distinction of respiratory therapies, which is Zopec Medical and Arca for this respiratory series. What is respiratory therapy? So respiratory therapy is a healthcare profession specializing in the treatment and management of respiratory disorders.
The threshold of human hearing is 0. Yes, humans can hear even at 0 dB. When you are breathing, the normal breathing is 10 dB. A very quiet room without anybody talking is 20 dB. That is how the WHO wants. No, one of the people is the International Noise Council. It wants the room to be very quiet, no talking in the night. Then a whisper. When I whisper to you, what are safe listening guidelines? One is to monitor our noise levels. Now,
so your different types of blenders, as I mentioned, you usually have high flow blenders and you have low flow blenders. High flow blenders give you a lot of output, up to 120 liters per minute. That's to be able to power devices such as high flow devices. You could be able to power high frequency ventilators, anything that needs a very high flow amount of output blended gas. A lot of times these...
Sorry, Dorothy, JC from South Africa.
Okay, please go ahead.
Just a question to you, Jimbo. As far as high flow oxygen therapy, do you see a trend towards an indication like a ROX or a non-invasive indicator for a predictive indicator as far as outcomes for high flow?
I think the more it's used, the more outcomes will be there, and then you also have patient preference too. I mean, there's a lot of patients that have a hard time tolerating the mask, and I think a lot more people are using high flow because of that. I know I would. I wouldn't necessarily want a mask on my face if I didn't have to have a mask on my face. But I think that as you use it on patients that aren't a last-ditch effort, you'll probably definitely have better outcomes along the way.
Yeah, because it's not
use it one-off.
So, asthma is a chronic airway disease. It's characterized by inflammation, bronchoconstriction, and airway hyperresponsiveness. It's really prevalent worldwide, and it's increasing. According to Hodgkinson, he predicted a 400 million increase by 2025, which is this year. And I can tell you that I see that happening because I'm actually part of, I joined the asthma support group. And every day, somebody is joining with a new diagnosis of asthma. Somebody, these are like adults in their older age, 50s, 60s, just diagnosed with asthma. And I also work in the asthma clinic, and I hear the patients talk about, they just got diagnosed with asthma. So I do see the prevalence, and I do see how it's going up, how that can be possible. Now in this picture, this picture here shows a normal airway on the left-hand side. This is a normal airway, right? Air goes in and out through the lungs, in and out, freely, no obstruction. It's nice and open. But when there's an asthma attack or an asthma airway, there's inflammation. There's inflammation, the airway is so tight, there's a narrow hole from which air is trying to pass through. And through that hole, narrow hole, that's where you hear the wheezing because air is trying to get through the narrow hole. They are coughing, there's mucus production, and then there's constriction of the smooth muscles. So all these things are going on, the patient is trying to catch their breath. So that's how asthma, attacks, or what happens in the lungs, on the airways when there's an asthma attack. I want to also really stress on this for healthcare practitioners, for us, right? we have to be mindful of what these patients are going through and what they are actually allergic to or sensitive to. Sometimes some of them might be sensitive to perfumes, the perfumes that we wear to go to work, right? I've seen that happen so many times, right? And then there was, I think this one happened last week or 2 weeks ago at the asthma clinic. The patient was brought to me to the clinic, but the lady, when she came to me, she was coughing. She started to cough uncontrollably. Now, she already knew what triggered that asthma because somebody from the front desk wheeled her. She was in a wheelchair, wheeled her to me, and that triggered her asthma. She said the perfume that she had on was, too strong. And so the global asthma COPD outreach was birthed actually because of this, to improve the lives of individuals affected by asthma and COPD through global, virtual, and in-person healthcare worker, patient, and caregiver education and advocacy. So what we believe here is that no matter everyone, no matter the geographical location and socioeconomic status, should be knowledgeable about the disease and have access resources available to thrive and breathe easy. Okay, so global asthma outreach is led by respiratory therapists. I wanted to also touch on the Arca mission as well. Arca is committed to uniting respiratory therapists and healthcare professionals across Africa to foster excellence in respiratory therapy, to ensure that every individual in Africa has access to high-quality respiratory care. All this is geared towards reducing the mortality and morbidity caused by chronic respiratory diseases, which asthma is one of them.
It's time for Africa. Let's rise and breathe as one. With the African response.
Dr. Walima Bakas Ali is a highly accomplished and dedicated respiratory medicine and allergy specialist, dedicated to advancing respiratory care in Guyana and beyond.
Today, my topic is on the effect of tobacco use on lung function and long-term health. Without any hesitation, I will go into today's topic. Tobacco smoking remains a concern and is the leading cause of preventable diseases and death worldwide. Its detrimental effects on the respiratory system are well known for linking tobacco smoke to the development of chronic respiratory diseases, and I've looked at COPD, lung cancer, and asthma, which are the three leading causes for respiratory diseases. The demanding impact of tobacco smoke is primarily due to its complex mixture of chemicals, many of which are toxic and carcinogenic. Understanding the key components of tobacco smoke that contribute to tobacco use and lung cancer. So lung cancer is one of the deadliest cancers globally, and tobacco smoke is unequivocally a leading risk factor. The association between smoking and lung cancer is one of the strongest and most extensively studied relationships in medical science. The British Doctors Study and the American Cancer Society Cancer Prevention Study have followed large cohorts of smokers and non-smokers over decades, demonstrating a substantial increase in lung cancer risk among smokers. These studies have established that the risk of lung cancer increases with the number of cigarettes smoked, the duration of smoking, and the age at which smoking begins. There is also the case control studies which consistently show that a higher proportion of individuals diagnosed with lung cancer have a history of smoking when compared to control. These studies also indicate a dose-response relationship between smoking and lung cancer. Now, immediately after someone stops smoking, within 20 minutes, you can start to see benefits. Blood pressure, pulse rate, reduced temperature in hands and feet return to normal. Within 8 hours, your carbon monoxide and oxygen level in the blood returns to normal. Within 48 hours, the nerve ending starts to regrowing. Ability to smell and taste is enhanced. Within 2 to 12 weeks, circulation and breathing improves and walking becomes easier. Within 1 to 9 months, decrease in coughing and sinus congestion and shortness of breath. There's increase in overall energy and lung ability to self-clean and reduce infection. Any patients who present to you with respiratory condition presents with the common symptoms of shortness of breath, coughing with or without mucus, fatigue, maybe recurrent respiratory tract infection, progressive shortness of breath. These are common findings. By just their presentation, you cannot tell that, okay, this is caused because of tobacco. But through their history, you can tell if this might possibly be caused because of tobacco. And the first test that you would order is your chest x-ray, which can show you tobacco related changes on your x-ray, and you can further compound that with your CT scan to confirm the changes and compare that if it's associated with tobacco related injuries.
And today's webinar series is brought to us by the Africa Respiratory Care Association, and it is proudly sponsored by Zopec Medical. Zopec Medical designs advanced hospital-graded power solutions, that is the UPS battery system that ensures uninterrupted power for critical respiratory and neonatal equipment. Now, these batteries ensure seamless patient transport, support early mobility, enhance physical, occupational, and respiratory therapy while transporting the patient from one unit to another or from one facility to another. It is user-friendly and safe, and it has visual and alarm systems in it, and it is compatible to all electronic devices or electrical devices that will support patient while transporting the patient.
The 4 life functions are the functions we need to survive, right? So to live. The 4 life function, we have pulmonary hypertension. No, we have ventilation, we have oxygenation, we have circulation, and we have perfusion. So we need all those 4 in order to live. What is pulmonary hypertension? Pulmonary hypertension is a condition characterized by abnormally high blood pressure in the pulmonary arteries, the blood vessel that carry blood from the heart to the lungs. So this increased pressure forces the right side of the heart to work harder, potentially leading to heart failure and other complications. So pulmonary hypertension, again, is caused when the arteries in the lungs become thickened and narrowed. This blocks the blood flow through the lung, which raises the blood pressure in the lungs and causes the heart to work harder, especially the right heart, to pump blood through those thickened and narrowed arteries. Over time, the heart loses the ability to effectively pump blood throughout the body. Pulmonary hypertension is not limited to any particular age group, although it is more common in adults, in those with pre-existing heart and lung condition. Pulmonary hypertension affects neonates, which we call persistent pulmonary hypertension, PPHN, in newborns, and pulmonary hypertension affects children, like pediatric children, and it affects older adults. So the interdisciplinary team collaboration is very critical. Even though you can see individuals going in and out in the patient room, doing their own thing individually, outside the room, we all collaborate. We all communicate for the best outcome of the patient to provide that excellent and safe care.
The third question is really not pertaining to the presentation today, but I'm gonna read it out, and maybe it said from Daniel Owusu, how are African leaders' reception of respiratory care, seeing that it is new to Africa and most of the duties are carried by RNs? So for Daniel, Ms. Dorothy, do you want to address that real quick? Or?
Okay, so let me take it and then you can add something to it. So Mr. Owusu, we have, when I say we, Arca has been able to reach some few countries, and we are still making efforts in reaching more countries, stakeholders. When I say stakeholders, through the Ministry of Health and the Ministry of Education, as well as other key stakeholders that matter in helping start a program like respiratory therapy. So, and most of them are understanding what respiratory therapy is all about. So therefore, the reception is really great.
The lungs. But most of the time, COPD are a risk factor, heart disease is a risk factor, pulmonary embolism, another risk factor, HIV and AIDS is a risk factor, smoking, of course, is a risk factor, and toxic drugs, some of the drugs and toxic can be a risk factor, et puis qui ont tuberculose, ça les affecte beaucoup en Afrique. Par rapport dans d'autres pays qui sont affectés beaucoup qui sont affectés en Afrique par le problème de cœur. Donc c'est les developing countries, les developed countries, like les pays qui sont développés, c'est plus souvent le problème de poumon, les maladies chroniques de poumon et les maladies chroniques du cœur. Mais chez nous, en Afrique, c'est les gens qui ont les HIV et puis qui ont les AIDS, qui ont tuberculose, qui souffrent beaucoup.
The future's looking bright, it's time for Africa. Let's make our vision real. The Africa Respiratory Care Association, here to heal.